My name is Dr. Ahson, and I'm a research professional. And today we are joined by Dr. Adiba, who is a gynecologist. She has been practicing for many years, and she's going to share the story of a patient of hers where a excellent outcome was achieved because of her diagnosis and intervention. Dr. Adiba, please introduce yourself and share this story with us.
Hi, I am Dr. Adiba Khalil. I am an obstetrician and a gynecologist with more than 30 years of experience. Most of my experience was in the army, armed forces of for Pakistan. My special interest is urogynecology, which means problems of women regarding their urine. And of course, I am an obstetrician too. This patient had been to multiple gynecologists, and as is very common with people who have, I would say, trauma and anxiety because of some problem in their medical problem in their lives, they go to multiple doctors. And so the continuity of care is missed and important things are missed out. She had in the last pregnancy that she lost when she came to me, somebody had already put a suture around the mouth of her uterus to help her carry that pregnancy, but that had been done empirically. She had never been investigated. So I advised her that she can have an ultrasound done, which we did have an ultrasound, and it came out that the length, the mouth of the uterus was too short to carry the pregnancy. So we devised a plan in which we would place that suture, that purse string suture around the mouth of the uterus, a little higher up than the usual placements of it. So next time around, when she came with a pregnancy, we did place that suture under general anesthetic with a little bit of dissection and hoping that this would carry. Unfortunately, after 1 month, even that did not carry, and she did had a repeat miscarriage. This was her sixth one. But I would really praise her that she was a very resilient girl. So when I came up with this idea that we can place that suture abdominally, they were very willing to do it. And after 6 months, when she had her seventh pregnancy at the end of third month, we gave her general anesthesia and placed that suture abdominally. The previous sutures had been done vaginally because it's less traumatic. You don't open up the abdomen. But two had been placed and both had not worked. So this time around, we applied it abdominally, where we were able to place that suture even higher up onto the mouth of the cervix with a nylon suture. She had an uneventful recovery and she carried that baby to term. At the end of around beginning and around 37 weeks, then she had a cesarean section. She delivered by cesarean section. She had a baby. Well, the happy part of it is that this was not the end of the story. Some 2 years later, I was posted out to another station since I was in the military, and did get posted out. And it was a very busy station where multiple patients we were going through the operation theater list. And I came upon a name which was vaguely familiar, but of course, there were so many patients, you don't exactly remember names. So I just saw the papers and saw, okay, I have to do this cesarean section. And I noticed there was an abdominal cerclage on this patient. And I said, okay, I was mildly surprised and happy. Of good, everybody is now thinking of abdominal cerclages for people who need them. But when I washed up and I was about to do a cesarean section, and it was my patient, nobody else but that, my original patient. And the patient was so happy to see me. She said she knew that I was in that hospital, and she had hoped that I would be the one doing her cesarean section. And eventually, I did do her cesarean section for the second baby with that same suture. As I opened it up, the nylon suture was still intact inside the uterus, and the second baby that I delivered via cesarean section was a baby boy. It was uneventful, and she was happy, and I waved her goodbye, and that was the last I saw of her. But at least I know now she had 2 babies, and she had tried so hard for that. This was one of the, and it was the happiness that I saw in her and both of the couple. And these are the things that keep doctors moving.
Dr. Adiba, thanks so much for sharing this wonderful story. A remarkable outcome was achieved for your patient, and we can all agree that a careful diagnosis is so important for the well-being of the patient. Thank you so much.